and we look forward to this meeting. It's going to be, as Agata said, an interactive one. We don't have a PowerPoint prepared because we feel that your questions, your ideas, and our conversation might be engaging enough, but we'll see. Okay, so I'm Christina. I'm welcoming here as part of the IT Health alumni community. I recently joined the EIT Health Alumni Board as a coordinator for InnoStar's East region. And since this is an Health Alumni event, we will be having at the end of our meeting a very short presentation of the opportunities that you can grab by registering in the EIT Health Alumni community. And it's going to be more or less a 5-minute presentation at the end. So bear with us for 1 hour at most. And you will be handed also with the code to join the community and to access all kind of interesting opportunities for your growth. So let's start it. Agata, are you ready?
Yes, I'm ready.
Yeah. This is the first event, or we intend it to be a series focused on digital health growth. So, Agata, before handing you over the mic to tell us more about you, let's tell the people invited here, why did we start this event and what was the, let's say, the purpose behind it? It's
Yeah,
not
sure.
another event related to leadership and marketing or whatever. We want to make it different, but how?
Yes, so we definitely will be focusing on Central and Eastern Europe, but we all welcome your feedback. But what we really want to do is focus in the InnoStars area because we feel that the business aspects of digital health have been very well addressed on the German market, on the UK market, even Scandinavian markets, but our markets are very different. So we want to share with you how to build it, how to go to market, and what's behind the idea of this series. Well, I came to Christina and the AIT Health as the alumni ambassador from Poland with this idea that I'm doing a lot of mentoring sessions mostly in Poland with digital health startups and students in incubators, also with some companies. And I've noticed that they have a very big problem with the business side because they are so focused on market admission, so getting certified and getting just admitted to the market, that they mix it with the market adoption, so getting real clients who are paying.
Okay. I would like to ask the audience, do you have this problem? Does this resonate with what you are facing now? So are you from what side of the digital health? Are you a student? Are you a startup member? Do you intend to transform your idea into a product, or are you already part of of business? Can you share it with us on the chat, or you can open up your mic and share your ideas on the subject? You can do that. And while you are letting us know more about yourself, I think it's time to invite Agata to tell us more about herself. So we are very proud to have you here, Agata. But I think you are the best person to present yourself, right?
Yeah, sure. So my professional career was centered for the past.
Okay, you can go.
Okay. I thought it was a question. So I've been working for past 12 or 13 years in communication and marketing for new technologies on the Polish market and on the international markets with a big focus on CE, so Central and Eastern Europe. And I've launched over 15 products and something like 30 educational programs and services. And in 2016, I was after some also some health issues, and I've noticed how much the patient experience area is unaddressed. So I started my own foundation, Health Action Tank, to support organizations and companies in developing patient experience strategies. I've worked with HIMSS on their interoperability standards. Right now, I'm in World Health Organization's work group on AI in health, and I've been nominated by them to be their expert on digital health. I also advise to the Polish fraction of United Nations on also on digital education, and I've worked, for example, with IBM when they were trying to get into Poland with their product. So I was helping them to do some market tests. And I will tell you also some feedback from it later on today.
Okay. Why did you focus on the health sector and not, I don't know, anything else? Climate or sustainability or digital, or why health?
Why health? I'm focused on many areas of new technologies, and my main focus right now is education in IT, also so education as in learning the skills, and also education like for example how the new technologies can help in some areas like climate change also. But why health? It was because of my own experience when I had very serious problems, and I was a person with private healthcare, access to private healthcare, and I live in a big city, so I have access to many specialists, and yet it was very hard for me, and I spent like over a year to address the issues, and then I was so disheartened with the whole industry when I was also talking to people that I wanted to do something about it. So when I started my foundation, everybody thought that I was crazy. And I think that even I thought this a little, but I decided that I want to do it. And then I was invited by Stanford to write an piece for them, and then invited to with join HIMSS and their working groups, and step by step, also through the cooperation like with IBM, I've noticed that yes, this is really a problem that the organizations, hospitals, the doctors and companies don't know how to address consumers and patients, how to work with them. And while at the same time, everybody was talking about prevention, that we need to invest in preventive solutions because the public health system can't support the development of chronic diseases, and they cost us too much. It's too hard, and it's a big pressure also on the economic systems, because if you have health problems, you cannot, sometimes you can't work for a long period of times, or your mobility is also challenged. So it started with my own need to do something. I've been volunteering since I was 19 years old, so for me it's very natural to volunteer, to share my time to do something. And then I've noticed that there is the real need on the market.
Okay. If any of the audience has questions for Agata, please feel free whenever to unmute yourself or just write in the chat. Just a friendly reminder. Agata, thank you again for sharing that with us. What stuck with me is the notions of patient engagement, of B2C, which means maybe not everybody knows business to consumer, and digital health. Well, why do you think patient engagement is such a big issue? You said something earlier, but I really like to clarify that. Why do we need
Yes,
patient engagement in B2C, for example?
yes, in general, why patient experience is very important because healthcare systems are moving and outside of hospitals. So when a patient is in a hospital setting, they are well not actively involved in the process of taking care, because there are nurses, doctors who tell them what to do, where to go, and they are just following. But if we, especially when we talk about chronic diseases like asthma, like diabetes, for example, where patients first, prevention is very important because we can prevent, often we can prevent these diseases. Second, the behaviors of the patients are important because you need to follow you need to actively engage to follow the requirements from your doctor, but also to observe what is happening to you and know how to react. And especially when it also involves behavior changes. So
Okay.
better diet, doing sports. So then it's also, you need to, as a patient, actively engage. And for example, in our group, so we are quite young, and probably we understand the importance of the preventive activities. So for us, it's easy to understand. But for example, in IT industry, I often talk with men who, when they define what is healthy according to them, they define it as, for example, extreme sports, running marathons or triathlons, or doing I don't know, skydiving, because they mix the physical ability with healthy behaviors. And while in fact, for example, extreme sports are very unhealthy, and you need to do a lot of prevention and to be able to do it. So definitely, if we want to develop any modern solutions, we need to engage patients to understand and actively involve in them.
Okay. So let's say I don't have yet, but I wish to. I have a digital health startup. So I'm focusing my product, my idea, my whatever to target patients. What is so special about the B2C, business to consumer sector in digital health? Why we should focus so much on patient? We know about patient engagement now from you, but what else we should be focusing on?
Yeah, definitely. What you need to remember is that if you are in B2C market in digital health, you are really in B2B2C. So business to consumer, because most of the times a doctor or a physiotherapist will be also involved in the process. So you need to address their business needs of the doctor, of the hospital, but also to address the consumer, so patient needs of how this device of software should work for them. So from the very beginning, and I think it's right now there are very few areas of digital health that are also strictly B2B. Usually, if you are not producing something for strictly for hospital and without patients going out of it and using your solution, so then yeah, you are in B2B. But most of the time, you also need to address the needs of the patient. So for example, if you are collecting some kind of data and they have like a smart band like me, and they need to connect to internet or to the app to send the data on the right time. You need to, for example, be aware of how well internet works in the area you're addressing. So,
Okay.
for example, Poland is quite a big country, and but what people here often forget that there are a couple of big cities, big agglomerations where everything works different than in rural areas. And people in the countryside are often those people who need a digital health solution most. So, for example, I remember like a befriended family from the mountain area was traveling a couple of 100 kilometers to the capital of Poland, Warsaw, so that one of their uh, sons can have a checkup with a doctor. So 5 people had to travel both ways so that he can have a checkup with digital health. He could have, like, for example, a checkup done by a local doctor, and doctor and the specialized center could check uh, the recordings and give feedback. So
Okay.
things, or if we are thinking about elderly people living alone and providing solutions to support them in their living, we need to remember that these elderly people don't live only in big cities, they also live in the countryside and their kids live in the city. So how do you address this consumer need?
So basically, we need to know from the start or as early as possible who are we addressing to. We cannot solve every problem in the world, but we have to focus as much as possible on who is going to use and buy our product, our idea. And coming back to that question, we have some attendants here. We have Smaranda. Hi, Smaranda from Romania. And we have other people, Bogdan. We have um, we have more people that are thinking about developing their startups. Smaranda is working on prevention medicine, and she's also a medical student. I understand Bogdan is more or less of the same way. Well, if you are like Smaranda or Bogdan or anybody else here, and they want to research new market possibilities for their ideas, where do they start? What do you
Mm,
advise us?
yes. So of course, first you develop your idea. Have some. You might think about the group you would like to address. Definitely, what is very important to remember who's the payer also, because there are like in Poland. So we have all the biggest payer is of course public administration, and as in most of the countries, it's
The same in Romania, and
public.
if anybody
Yeah.
else has other experience, please feel free to share. But I think in Eastern Europe, the public payer has all the power.
Yeah, so this is the public payer first. Then there are private insurance, so you can buy access to a private clinic or chain of clinics, and especially in the bigger cities. And then there is the consumer themselves. So when they go to the private doctor, or when they buy just on the free market some devices of or access to the software. But it's very important definitely to remember who will be paying. And so this is one thing. And with the public sector, it's very difficult to get to be enrolled for the refunds. I remember when I was on one conference, and there was one of the most well-known doctors in Poland talking to the Minister of Health. So the doctor was saying, we have so many amazing solutions, but we need more money to implement the digital health into the healthcare system. And the Minister of Health was answering, well, I love these solutions, but you need to fit them in the budget you have right now, because you won't get any more. So it's a long road to earn money just from the public sector, unless you are very lucky and your product, which you've started developing a few years back, when you are ready to get to the market, is something that the system needs, and you don't have a big competition. But what to start with? So what do we start with? We always start with researching with the money. So where is the money in the market? First, of course, who is the payer, but this is not enough.
Follow the money, right?
Yeah.
Follow the money.
Yes, follow the money, exactly. So when you think about the B2B, so hospitals, clinics, you really need to understand what is their budget per patient, per visit. And of course, talking to the director of a hospital might be difficult. Maybe some information can be found in some public documents, because it's public funding. But you can also talk to the doctors. I remember when I was working with IBM a few years back, I talked to one doctor who was considering first their solution. It was, I think, Watson Health. It was called this, but he told me two things. First of all, the solution costs over 4 times more than he has whole budget for the patient's visit, including administration and time. So it was just from the very beginning a no. So you need to know how much do they have, and you need to calculate if how much of this percent of this budget you'll be taking, because as I said, in this budget they often have, in Poland they had to pay for the administration, for the documents, for software, doctor's time, nurses' time, everything. So, and if your offer will be much more expensive, then you are left only with the private sector, the private hospitals, private doctors' cabinets, because they can just charge more. But also the question is how much more they can charge their clients, the patients, so that they still pay for it. So this is on the B2B side. On B2C, you need to see what are the prices of potential competitive products on the market. So you you need to also check the lifestyle industry. For example, how much smart bands cost, smartwatches, even what type of smartphones people use. So if they use the low budget mostly, or mid-range, or top range in the country, because this is, maybe you might think, well, it's not my competition really, but in the minds of these people, this is, because if they see that they can have a free diet app and then they need to pay to use your app, they are wondering why. And it is still very early market for digital health, so people are not yet so used to this using and having just medical devices or medical software, unless it's something they need to use permanently.
Mandatory.
So definitely, go through the go through like public administration, any documents you can find of finances, go through industry and consumer reports, also for new technology, anything that may seem to your customers to be a competition to your offer. And also when you go to the B2B market, look at the pricing of your competition, because there are already huge consulting companies that are on the market and that have very high prices. Maybe you can, and how do you compete with that? I
have
see
a
that we have
question.
a question here. Yeah.
And two questions. We have already one on the chat. So
Sure. So,
Fruzina,
if you could
want
start.
to.
Yeah.
Yeah, hi. So my name is Fruzina. I'm from Hungary. And thank you, Agata, for telling us about this situation in Poland. I'm very interested in Poland, actually. I have two hats currently. So on one side, on one hand, I am working as a health economist, and the issue we are tackling at the moment is exactly what you described, is to allow and help and aid startups to enter new markets and to be publicly funded. So what we do is called early health technology assessment, and we assess the technologies, the medical devices or digital health application softwares to see whether they have the competitive advantage and whether they are cost effective in the given area, in the given country, for example. And we prepare a dossier to for them to hand in to the local regulators to help them get accepted by those local regulators. On the other hand, I am also part of a startup. We are developing a service that is actually, the goal of it is twofold. It is, on one hand, it is kind of a telemonitoring system. So it's a digital health application or software, I would say. And on the other hand, it has to do with big data analysis. So we use AI to analyze all that data we collected to provide decision support for healthcare workers. So my question for you would be, given that you're from Poland, and that's great because we are actually just now trying to enter the Polish market, because the situation here in Hungary is that the regulations regarding acceptance of digital health softwares or digital health applications are they are not very favorable here in Hungary. So my question to you would be, how innovative or how well developed do you think the Polish, or you can also answer it in general for the CCE region, how well developed are the regulations regarding accepting innovative solutions or digital health applications softwares?
Okay, so
Before you answer, Agata, sorry, we have quite a similar question on chat from Tanya from Bulgaria. She is also wondering about the limitations to smart solutions that will be finally used by patients. And I think it's somehow related, right, Tanya? More or less?
Yeah, more or less. I was just thinking about the barriers. And as you mentioned, the first one is who is going to pay. But I'm thinking also, coming from Eastern Europe, is like how possible it is for people to actually use those. And if in the end, you're just going to target those who are able to, and kind of like finish there.
Okay, so my answer will be in three parts. First part is the legal system, and is due to the current situation with the pandemics. The acceptance of digital solutions have developed a lot. So legally, you can use a lot of solutions, but I'm not a lawyer, so and I'm not a digital health lawyer, so I would advise you to just consult it with lawyers. If your solution for sure works technically, we have a lot of telemedicine solutions already on the market. When it comes to, so this is one part, the second part about financing. So what I've noticed right now, digital health solutions are mostly first accepted by private clinics, the leading hospitals, so the best specialized, for example, in cardiovascular operations. So they have a Definity, and it's developing. If you will put in Google Da Vinci and plus report, so then you will see some reports of how this Da Vinci technology is getting accepted in Poland. I think there are about between 10 and 15 robots, Da Vinci robots in the hospitals, so it can give you an idea. And when it comes to like smaller solutions, it goes really region by region. So it's easier to get to find, for example, to work with one just area, one region, when they see the need, or with one hospital who will have the money or will get the funding to equip their patients with telemedicine, or for example the local public administration will want to take better care, for example, of seniors, and they will have money to buy this solution and share it with them. And the limitations, the limitation is always technology. So what I would research first, for example, find some reports from Google or from Apple on on their software. So which software, which version is most popular in a different country. And there is definitely a report with on Android for each of the country, and then you can see if these are modern mobile phones, or maybe they use the old version. So access to technology and what systems they have. And the second one is access to internet, the pricing. Fortunately, I think in Europe, it's not such a big problem as in the United States, for example, which is always something that for me is unimaginable, that in the United States they have like the internet is more expensive than in Europe, and there are people who already have problems in Europe or United States with the access. But technology will always be a limitation. And then of course financing, but the big private hospitals or private chains of clinics, they want to introduce often telemedicine solutions because they earn money on it, and it's easier for them, for example, to have this solution. But to looking at the like national level, it will take some time to introduce solutions everywhere. From what I heard, usually these are on the local level. And so you need to plan for having like a lot of salespeople on the ground, talking with administration, and it will take time.
So thanks for your response. So I think because the private sector in Hungary is so small in healthcare, so it's tiny compared to the public one, the market would be rather small for us here if we would be only looking at selling to private. And I think in general that's what characterizes digital health solutions here in Hungary. So would you say it's the same in the entire CCE or in Poland as well? So what's the ratio of private to public market in Poland?
don't have the data on it. So, but for sure, we have in whole Europe, we have public healthcare as the main type of delivering healthcare, and people are used to it. So it will always be like the main thing, especially for surgery and bigger problems. So definitely public sector will always be leading. Private sector, it depends, because the like private chains, so they are in most of the big cities. They have many clinics around those cities, and they, for example, they have a lot of programs sign up with leading companies, and where they buy private healthcare for their employees. So, but this is in big cities. This is mostly addressing people working age. And so there is also, of course, the market of private doctors' offices, but they usually don't have such a big budget for these solutions. I think what would be the best for you really to just engage someone who's Polish speaking, and to go for you through the industry reports and consumer reports, because this is the question that the answer can be found in these reports really, and in maybe some articles in media. So
Agata, I have a question that originally came from Marina when she registered, but I think it's relevant for most of the people that are watching this webinar. How do you define digital health? Anything that is combining health issues with digital approach could be a digital health product or solution, or is there a more targeted or focused way of looking into things?
Yeah, so again, there will be a difference between B2B and B2C. In B2B, it will be always MD or SAMMD, so certified medical device or certified software as a medical device. You need to get the official certification from EMA, I think, if I'm not mistaken. So you need, but generally to get into the B2B sector, you need official certifications in well, to get as a medical device to the consumer sector also, but the consumers, this is the difference how consumers understand digital health. So for them, also diet apps from influencers or fitness apps, fitness gadgets may also count as digital health. So this is a very
competition between wellness apps and digital health app. How can you see the line clearly?
Well, as this is the thing. This is also your job your job to educate market about your solution, but you need to understand that the consumers will see wellness, may also see some elements of wellness industry as digital health, and you have no power over what they think, because it's a new, when an innovation comes to a market, something new, people like to compare it to something they know. So they will, and the fitness industry, the diet industry, and wellness industry were first on the market. So you just need to accept that it will be you will be working also against them to build your market, and this is as what it is, and you cannot do right now anything about it. In 5 years probably it will be different, maybe even in 2 years, because right now the telemedical solutions are more and more important on the market, but it's a long way. And so you need to understand it for your communication.
Okay. I have one last question since we are approaching the end of this session, and I want also to have some space for the people to ask other questions, and my 5 minutes related to EIT Health alumni community and your opportunities to join. So funding, it's clearly an issue whenever you look at it. What do you think about accessing European funding, or Smaranda is writing here on the chat, pitching as a social entrepreneurship solution to also get some funding to back your digital health idea. What do you think about public grants funding in startups case?
So before I answer that, I would like to you to focus on one more thing, because before you will even apply for the funding, you need to have a couple of issues addressed just to go as your go-to-market strategy. So, and how the market looks. So as going back one more time to market research. So what is very important for you is in B2B, but also a bit in B2C, is interoperability. So right now, there are a lot of, like I've noticed that a lot of digital health startups are building their own apps, their own software. But what the general industry needs is interoperability. So if you make, for example, device and an app to use or to analyze data from this device, this is useless for a doctor who needs who has their own system, and they don't have time to just copy by hand the data. So, and this is something I've been addressing on the American market a couple of years ago with HIMSS, exactly that. So this if what will be very helpful for you to get to the market, to learn what software they use, or the data management techniques and technologies, and adapt to it, so that you are not a standalone solution, but you can be a plug-in solution. This is one thing. And another thing that will be important for you is frequency of use versus predictability of use, because so either how often your solution will be used, or when it comes to B2C, or how unpredictable it is for the patient they can't predict when they will need it. And so then, for example, because their eagerness to buy from you will depend on these two areas. And also, if you are, for example, in the low frequency, more or less predictable, how does it work from the point of view of waste time? Waste time is all the time when your solution is not used versus cost. Because if it's very expensive to buy some kind of device, which you don't use, because for example, I have asthma, I should have like every 6 months I should do a spirometry, but I don't need to buy my own device because I go just sign up for the clinical test. So, for example, one thing that a company from Poland brilliantly thought of, so they are borrowing or lending, I always miss it. So they are lending.
Borrowing that taking.
Yeah. So they are just, you can buy it as a one-time service. They send you the device, you do the clinical test at home, and you send back the device to them. So, for example, you might be in you might be producing a device, but you might be in the service market. And now going through from this to funding, and you will see in a moment why it was so important, because when it comes to European funds, I'm a big fan, but you need to be very precise with your business model, with the technology you use, because once you are accepted, and then you cannot change really anything. It's very hard to get acceptance on changing technology, changing business model. On the other hand, it's easier to get funding for when you don't have like for innovation and for tests from VCs, but then you give them part of your company, and most importantly, they are like your employer, so they can expect from you certain activities and outcomes. So this definitely, this is something you need to think about. As to doing this as a social entrepreneurship, then you can ask more, well, then if you do, the question is, if you, as a social entrepreneur, do you register as an NGO, so as a foundation or as a non-governmental organization which cannot have shares and which cannot, so you won't be able, for example, to draft the money from the earnings. You can only invest it in building the solution. Or do you start a private company, but with this mission of doing something good? Because if you are in the NGO sector, you can apply for European grants, you can apply for just grants from, for example, private foundations like Bill Gates, but no VC will invest in you, and then you cannot sell this company, you cannot earn if you will earn a lot of
Profit
money, you can have just your standard fee. So these are the things that really need to be addressed.
Yeah.
So, for example, I started a Health Action Tank as a foundation because I knew that I want it to be an NGO, and accepting that with my another company that I'm working on right now. I'm looking for different solutions for starting a private company because I want to be able to turn it into shares or to sell it. So it's a very important decision.
Yeah, and as a conclusion on this subject from my part, money is very important, but you shouldn't, and it's totally unadvisable to adapt your solution or your idea based on what the granting fund is financing, and you should find and look for the right opportunities for your idea, because you would find yourself stuck in some moment or another. So look for the money, but don't change so much your ideas or your products just to fit in the boxes, because they might not be your right boxes. Okay, so do we have any questions from the audience? Any feedback? What do you take out of this meeting? Feel free to share on the chat. And I will be presenting very shortly what the EIT Health Alumni Network is. It's the huge and very valuable community of innovators that is built out of people that have participated in one way or another in EIT Health programs throughout the years. It's very valuable to be here because you can attend some events, you can join the events, you can propose various activities, and you can even find your future co-founder or funding for your startup, your ideas. The whole Europe is split in several regions. We are presenting here the InnoStars East region, which is more or less this, the Eastern Europe from Poland to Romania. And I'm currently acting as the alumni community coordinator for this part of the world. And what I'm doing here is helping you create opportunities. So as Agata is doing today, as a guide for startups in digital health you can be doing tomorrow. The whole community is over 2,000 members, but in our part of the world we have more or less up to 300 members, and we really want to increase the number because people have the opportunities to, as I said, get hired, network, create new business opportunities, or join several campus or entrepreneurship programs. And we also have this very nice website, the IT Health Alumni, that you can use. You can see various events that are going on, or even some very interesting job opportunities. I joined the EIT Health community 2 years ago, and I have grown a lot of expertise there. And you can do it too. This is the code you can scan on with your phone, or you just can access this link, alumni.eithealth.eu, and join the community. But you should mention that you attended our alumni or one alumni event to be validated. So any questions for me or for Agata, we are here to answer now, or you can write us also in on email, or and in the EIT Health portal, for example. You can
or you can connect with us on LinkedIn. I've copied my LinkedIn address.
Yes.
Just one thing, please write that you're from this event, because I get a lot of spam invitations. I'm just in some weird algorithm, and it takes me ages to go through the invitations. So it's always safer to write from where you are, because then I can accept, and there is no problem with that. Christina can confirm she sent me invitation 1 month ago, and I only found it week ago, because I just can't cope with this spam, unfortunately.
Well, I didn't take it personally, so it was okay.
Yeah, and I'm also of course, on the EIT alumni network portal, so you can write to me also there. Yeah, and for everyone, I've answered the question from Bogdan, which was 198% of digital health startups fail, and it's because they, as we've said before, they focus too much on technology and product, and not enough on developing and confirming business model. And when they run out, usually they run out of funds because on the development stage, and then they don't have enough funds for entering market or the business model. It's just something that that's unacceptable for the market, because it doesn't work like this. And as I said in the beginning, it's market admission versus market adoption, and a lot of people just makes this mistake.
Great. Well, if there are no other questions now, but we welcome your questions on LinkedIn or whatever channel we might be found. Thank you so much, Agata. Thank you so much, everybody, for attending and questioning us. And we will publish this video on EIT Health Alumni YouTube channel. We do have something like this also. But until then, I think we might be meeting in the same structure next month, right, Agata?
Yes, and then I will be interviewing Christina about building business model. So it's the follow-up to our today's meeting. And definitely, if you have any questions for Christina, please send them in the form when you'll be registering. It always helps us to prepare the event and to make sure that we'll have time to answer your questions. And thank you, everyone. It's so great to see you all here. And also thank you to Nenat for saying how much interoperability matters. Yeah, definitely we talk too little about it in Europe yet.
Okay. Thank you. Have a nice evening.
Thank
Bye.
you.
See you next month.
Bye.
Bye-bye.
Agata, will you
Thank you very much. See you.
Agata, will you wait a couple
Yes,
of
sure.
minutes?
I'm
Yes?
staying here waiting.
Let me stop the recording.